So I've been an existential therapist for probably about 30 years now. Um, I've written some books, articles. I do a lot of teaching and training in existential therapy. My mentors were Jim Bugental and Irv Yalom, who I have incredible gratitude towards. And I'm in the time of my life where I really want to share what I've learned and mentor therapists in this perspective, which I think has so much value. Oh, I see some familiar faces. Hi, Amy. Hi, Terry. So I'm delighted to be here today, and I have three panelists who are at the top of the screen for me anyway, who have been participating with me in some of my consultation groups for many years. I'd like to introduce them first before we start. The person next to me is Dr. Brack Self. And Brack is a psychologist in the Bay Area. He's been in a number of trainings with me and is currently in an ongoing consultation group. And Brack is going to be a TA with me in a course that I'm going to teach for the Portuguese Existential Society in September. And next to Brack is Dr. Stephanie Weissman, who is another member of a different consultation group. And Stephanie has been working in training with me again for many years and has been part of the Existential Humanistic Institute as well and part of their training too. And our third panelist is Almu Mazzaro. And Almu is joining us from Madrid. And Almu is in another consultation group with me that is kind of international, wonderfully international. And Almu has come to the United States and been a part of their training for several experientials. And Almu has been in a consultation group with me also for many years. And she is also going to be a TA with me for the Portuguese Existential Institute's course that we're going to be teaching starting in September. So welcome everybody, and I'm going to get started. Please bear with me with the technology a little bit. I'm a little bit of a Luddite on this, so I'm going to do the best I can here. I'm going to share my screen here so I can get the PowerPoint up, and we'll see what happens here. Okay. Okay, so hopefully everybody can see the screen. Yes, good, wonderful. So my presentation today is on existential meaning making. And the subtitle is The Heart of Therapeutic Change. And the reason I describe it in this way is that if we're present to our clients' existential meaning-making process, it takes us to the deeper levels of their psychology, to what I really describe as their structures of being, which is where real healing and lasting change can occur. And so that's why I believe that it's so crucial to be able to appreciate the significance of existential meaning making, to be able to identify it with our clients. And I really think it will help. I hope it will help, and know it's helped me to understand their structures of being, to understand their protective stances, to appreciate them, to experience their wounded parts, and help them heal. So here are some of the goals for the workshop. I want to help you have experiences of the meaning making process in your personal life as well as in your professional life, to explain how the meaning making process creates a personal context, to discover how and why we create limiting protective stances, and to appreciate how an awareness of our personal context as professionals can help our clients become aware of theirs. And the fifth one is to do a case that I want to go through with you to help you see how a client uses the meaning making process to recreate her personal context after a traumatic event. So this is what I'm hoping we can have happen today. A discussion and some experiential exercises. I hope we have time for a live demonstration and then time for question and answers. So let's start with a definition first and process of the existential meaning making. Rollo May, as many of you know, is one of the founders of existential therapy, describes meaning making as a passion for form. So Rollo described it as passion for making form, because we have a discomfort with the uncertainty in life, in our experiences, and we need to make sense of our world. And meaning making is not a purely cognitive process. It's really important to appreciate. Meaning making is a full-bodied, experiential, sensory process of working to make sense. And then what follows is then we see the world we make. And what that means is that once we create our sense of the world or a sense of an experience, then we're very likely to recreate, to see it again when something similar will happen. Let's go to the definition and the process, and then we'll check in with the panel. So meaning making is an ongoing, and that's an important piece, dialectical process of making sense of the objective world, using thoughts and feelings and our imagination to create a personal world. And here we're going to call it our personal context. By ongoing, what I mean is it's ever changing, it's ever in process, and it's a dialectical process because it's a dialectical connection between the external world and our internal world. And so it's a back and forth. So how does it work? So we perceive something in the external world. If there's no meaning construct that exists, we'll co-create with the external experience a new meaning construct for ourselves. If a meaning construct does exist that we've created, we'll make sense of what's in the external world based on that internal construct that we have. Does that make sense? So one of the things I'd like you to just reflect on for a moment is, what are the positive aspects of this meaning-making process that's in all of us And what's the downside of it? And Stephanie, Almu, Brack, I invite you to share what your thoughts are on that.
Well, the negative is what comes to my mind first, which
Yeah.
is that you have a difficult experience as a child. Somebody hurts you in some way. You draw the conclusion that the world is a hurtful place. And then you move out into the world with that conclusion in mind.
Mm-hmm. Mm-hmm.
And positive could be the opposite of that. I remember when my son was an infant, having this really clear sense that I and my partner, that we were his world. And if we were kind to him, then the world was a kind place.
Mm-hmm. Mm-hmm. Yeah.
One thing I love about this, Orah, is that the kind of dialectic that in order to make meaning out of something, you have to make choices. And when you make choices, you eliminate something. You create something, but you eliminate the other possibilities. So
Yeah.
that it's not like there's it's not like it's possible to make meaning out of something without eliminating something.
Eliminating something. Yeah. That's so true and so important, because it's the eliminating that can create difficulty at possibly, because then we're not letting what else might come in. But that's what happens when we make these choices in our meaning making process. Absolutely. And as therapists, we have the opportunity to come in and introduce the possibility of other choices, of other ways of being.
Can I highlight just one more thing about this meaning making, and maybe later we'll talk more about that, but it's also a process of agency.
Absolutely.
Right? It's in making that meaning that we get to assert our own
agency.
agency.
Yes, absolutely. Exactly. That's why we call it existential meaning making, because we are making choices and we are exerting our own agency. And that's a very important aspect for us as therapists to appreciate, that our clients have made, well, we'll get to that. They've made this meaning, which means they can make new meaning.
And I think it's important to note that they're often unaware of
Absolutely.
the agency.
Well,
they think the meaning they've made is the meaning.
It's the reality, right? Yeah, yeah. Well, that's part of our job too. So here's just a very simple example that you're all aware of. You know, when we perceive something in the external world, we make sense of it. And the Rorschach ink blots are really good examples of how, you know, that you're asked, what do you see? And it comes from our own personal context, right, of what we see. So, for example, Almu, what do you see there?
So my attention just went to the right side.
Okay, what do you see on the right side?
So first I see a blue sky, which is bringing me joy, and then I see a cloud which seems to have clouds that look to me as maybe a young lady with wings that is flying in the sky. Yeah. That's what I see in the right side.
Yeah. And
I'm mhm.
anybody see anything on the left side on the Rorschach? The meaning? Any meaning? Any image that comes to mind? Go ahead, Stephanie. What were you going to say?
Last time I looked at this card, I saw lungs, and it seemed like that's all that there could be. And this time I see two funny kinds of beings colliding with each other.
Yes. Isn't that interesting? You see something different. So the meaning-making process influences the world we make, and it influences our interpersonal encounters. And we have experiences this with our clients all the time. For example, I perceive an external event. I run into Sally, my friend, and suggest we get together. She smiles, she says, okay, but I need to check my calendar. So I listen to Sally and I use my internal beliefs and feelings to make sense of her response, right? And if I believe I'm not likable, I'm going to hear and see Sally's hesitation as evidence of I'm unlikable, aren't I? And then what can happen is that my painful feeling of I'm unlikable will trigger my default protective stance, which is to separate myself from this evidence, from this painful evidence. And so my default stance is I cope by walking away, feeling angry, saying to myself, I'll never ask her again. If the event is important, I'll incorporate it into my personal context. And so therefore, Sally's behavior will confirm my sense of I'm unlikable. Now, this is an example, of course, of how our personal context influences our interactions with other people. And we encounter this with our clients all the time. And one of the things to appreciate here is that the protective stance is not something to try to jump over, but really something to help a person appreciate how it's in the service of keeping their hurt part from coming to awareness. And as therapists, I think it's crucially important to recognize the value, the functionality of our protective stances. And all of you who've worked with me know that, how important and indifferent this is than typically understanding it as resistance. Because I believe that if we appreciate it as something that's functional, we can have more empathy for it and we can help our clients work with it better. So the existential meaning-making process creates our personal context, and this is crucially important to appreciate as we understand our clients, that they all have their own idiosyncratic personal context. As all of you are here, reflect on the fact that each of you has your own very individual personal context that you have created from your life experiences. It's your subjective beliefs about yourself, others, and the world. And connected with that are all the feelings about yourself, other, and the world, and your protective stances. Altogether, it's an experience of who you are. So there are many ways to understand a person's psychology. Oh, I'm sorry, I'm going. This is simply one way to understand it in terms of constructs. I am. So for example, a person who believes I am damaged. And the feeling connected to that is I feel ashamed. The other person, that means everybody else in the world who they come in contact with, you will shame me. And the feeling that I have about that is I'm afraid of you. The sense of the world is cruel. And I feel sad about that. Now, these are very vulnerable, painful feelings that a person may carry. And in order to help a person cope, each of us creates a protective stance to cope with the psychological pain from our self and world constructs. And they manifest in different ways, concretely. And that's usually the first encounter is in the therapy room with a person's protective stance when we first meet them. And they take various forms. And I've just sort of made some brief summaries of that. There can be a person who's the avoider, who avoids dealing with issues, with feelings, with the therapist, a pleaser, a critic, someone who reports on her or himself. And in the case that I'm going to present today, Mimi, it can also be emotionally charged phrases, like the one that Mimi consistently said to me when I first met her, "It isn't fair, I wasn't prepared." And like tips of an iceberg, the protective stances are visible aspects of a person's personal context. And what's so wonderful about them is that they're literally our ports of entry into their personal world. So if we pay attention and we cultivate presence to them, we'll be able to go to deeper levels of the structures of being of our client. So the significance of the personal context is we see ourselves and the world through the lens of our personal context. We manifest our personal context in concrete ways of being, like the pleaser, avoider, the reporter, the critic. If we as therapists cultivate presence to our own personal context, that allows us to be more able to help our clients be available to theirs. And the participants here on the panel know how important I believe that to be for us as professionals, that we have to understand what our own personal contexts are before we really are able to help our clients, because we are the tools of our trade, and we need to understand ourselves as well as we can. So we avoid getting triggered too much, or if we get triggered, we can work through it with our clients. And here's the important part for change in therapy. Given that clients have created their personal context, and this is the agency quality of it, it follows that they have the agency to recreate their personal context. And I think if there's anything that you could take away from this presentation today, it's that to really remember and to hold as you work with clients, that the clients have the agency to recreate their personal context. If we can help them, if we can, in the last point here, if we can develop the healing experiences that address their protective stances, their pain, their wound, we can help them make new meanings and recreate their personal context. And that means essentially having them change at a molecular level, so to speak. Now I'd like to engage everybody in an experiential exercise to reflect on your own meaning-making process. So you might want to close your eyes, take a couple of deep breaths so you get yourself sort of present and slow down and grounded. And just listen to what I'm saying and allow yourself to remember to have any images come up, sensations, feelings, and so on. So first reflect on a significant experience you had before you were 10. What happened? Who was there? Create the memory of it as vividly as you can, recognizing what happened to you, who was there, and then also what feelings did you have? And then take a moment to reflect on the meanings that you made from this experience about yourself, about others, whoever might have been in the experience with you, and your world. What meanings did you make about yourself, others, and the world? And then reflect on the feelings that you associated with those meanings about yourself, others, and the world. As you reflect on those meanings and feelings associated with that experience, ask yourself, are those meanings and feelings about yourself, others, and the world showing up in your life today? And in what ways? Reflect on if they're limiting you in some way or they're expanding you in some way. So now I'd like to just invite, Vanessa and Roxanne, you're invited as well too, to share, if you'd like to, what you became aware of as you did the exercise.
I had a memory of being in kindergarten, and one of my playmates grabbed my arm, and her last name was Brown, my last name is Brown, and I said, "Oh, we're both Brown." And she grabbed my arm and she put it next to hers, and she said, "No, I'm Brown and you're not Brown." And she was talking about race, and I was talking about our last name. And I had this feeling of shame and this realization that there are people who think differently and experience the world differently than me. And then when you had us reflect on how that is affecting our life now, I think that in some ways I sometimes get caught in that trap again of assuming that people have the same worldview as I do, and then needing reminders often that people think differently than me. And that I think that still brings up shame sometimes for me.
Okay. Thanks for sharing that. Just one other person, and then we'll move on. Anybody else? No? Okay. Yeah, the meanings we make is in our childhood, as we do this exercise, we can begin to recognize how much they're still with us and in what ways, and how they can be impacting us, and what we can learn from it as individuals and as therapists to be more effective therapists, and also have greater awareness as human beings, really, about ourselves. So the other exercise is to reflect on your personal context. And this might take a little bit longer, so I'm not going to dwell on it too much. But I'd like you to kind of just reflect on your own personal context and see if you can, first of all, just identify your go-to protective stances, what that might be, and what are the attitudes and the behaviors and the feelings connected to it. I'll share one of mine, which is being very cautious. I'm a pretty shy person, and I hesitate to kind of insert myself until I feel like I'm welcomed. And so I tend to stay back and sort of get the lay of the land before I move in. You probably can notice that just as I'm doing this presentation, you know, that's coming forward. I'm pretty sure. Anyone else want to share sort of a go-to protective stance they're aware of?
Well, I'll share that I use humor quite a lot to keep myself from harsh things. And one of your questions here is, how does that contribute to getting stuck or triggered with clients?
Yes.
And it means that I can be very easily seduced by a client and sort of join with them on a very superficial level if they're clever and I'm clever. And I have to remind myself that we're not here to be clever.
Yeah. To kind of step back from that go-to place in you of being clever and joining with them and sort of recognizing that there's a collusion going on, in a sense.
Exactly.
Yeah.
And I think also that when you use, well, for me, using humor, using cleverness also has the element of wanting to charm other people. And really, it's not my job as a therapist to be charming, to be likable.
Yeah. Yeah.
You know, I want to be trustworthy.
Yeah.
But if I worry about whether people like me or not,
yeah,
then that's not helpful to the therapy.
Yeah. I think number 4 is so important for us as therapists, and the participants in my consult group know how much we emphasize that in our groups. So much of the time, one of the participants will bring in a client, and will really focus on how the therapist is getting triggered by the client, and do some work in terms of their own personal context. Not therapy, but consultation in terms of understanding what's getting triggered and how you can work with it and work through, see the enactment that's happening between you and your client, because that's usually what's happening, and how to work your way out of it so you can actually be helpful to your client. So I invite you to create this personal context for yourself when you have a little bit more time. And number 3, I invited you to look at that your sense of yourself might change from being optimistic about yourself to more pessimistic, depending upon the moment. I know that's true for me. There are times I can feel like on top of the world, and there are times I can feel like, well, if I'm doing therapy and I don't know what's going on, like the worst therapist that ever lived. So it shifts. And I think that's important to appreciate as well. Okay, so I'm going to go into this case. Before I do, is there, Vanessa or Roxanne, do you have any information about any questions or comments that the group has that would be helpful to take a moment, a couple of minutes to respond to?
I don't see anything in the chat presently to share.
Okay, okay. Well, I can't see you all, but I invite you to ask questions if you have any, so I can clarify as we go through this, okay? So this is the case of Mimi, and let's see. This is written up in the Existential Humanistic Therapy book that I co-authored with Kirk Schneider. So the longer version is there. This is the condensed version. But if you're interested, I wanted to give you a reference for it. I think this case with Mimi is a good example of how she and I followed her meaning-making process to help her heal from a traumatic event, and also, interestingly, to reconstruct her personal context. And I created a sort of a case study here for your benefit to see how, from an existential humanistic perspective, a therapist like me thinks about and creates a case to work from. So the first part is to listen to Mimi's story with presence to her meaning-making process. The part 2 is to reflect on her context based on what I hear and the functionality of her symptoms, to really try to understand how are her symptoms functioning for her. Part 3 is to develop and collaborate with her on goals and methods. And here I think it's important to recognize the value that we hold as existential therapists in the relationship. That I learned from Irv Yalom the value of being transparent about goals and methods, how I work, inviting questions, inviting collaboration, and checking in with my clients regularly about how we're doing and what's not working for them. Part 4 is to focus, this is the work, to focus on her meaning-making process, as you'll see how we healed the trauma and how she was able to recreate her personal context. So first of all, we listened to Mimi's story, the content. Mimi was having lunch with her 3-year-old daughter when a plane crashed into her living room. She came to see me several months after the event. She was still expressing fury at the pilot, saying, "What a stupid man, it isn't fair. I wasn't prepared. My house is in shambles, mice are eating my clothes." And she kept repeating this again and again. Mimi was clearly suffering from extreme agitation, anxiety, insomnia, and a loss of appetite. And she was pregnant, and she was due with her second child in 2 months, which meant that our therapy was very short, and in some way it really helped move it along quite a bit because it made it very intense. So Mimi told me her story, and as I listened to Mimi's story, I was listening to not only what her story was, but how she was telling me her story. And this is so important as a therapist, to listen to the way in which your client is telling their story. Mimi's way was she was constantly raging at the stupid man, the injustice of it. And she kept saying, it isn't fair. I wasn't prepared. So Mimi was really unaware of something here, which I was aware of. And this is an example of attuning to what is actual, but often invisible in our clients. Mimi was describing a sense of injustice and betrayal in some way, but she really wasn't aware of what that was for her, what had felt so unjust at a deeper level, and how she felt betrayed. And it felt to me like her constant repetition of this phrase was actually functioning to ward off these feelings that she wasn't yet ready to feel. So in addition to listening empathically, I gathered some other relevant information about her. Obviously, the demographic is she was a Persian woman who had come to this country when she was 10 years old. She was 37, she was married, she had a young child, and she was pregnant. Mimi had excellent pre-trauma functioning. She was a teacher. She had good but somewhat rigid coping skills. And Mimi was highly motivated to change, which, as you can appreciate, is a very important aspect for clients. And it helps us be very successful in our therapy. So I'm not taking much of the credit for this. So let's look on the left-hand side of Mimi's pre-trauma context. This is what I put together as I listened to Mimi. My sense was that her pre-trauma context, her protective stance was being prepared and being good will keep me safe. So Mimi had a sense of control, and being prepared was a good thing, and her world felt very ordered and safe. Her sense of herself seemed to be, I'm good and I do good. Her sense of others are either good or bad, kind of a rigid sense of others. Her sense of the world is a safe place if I'm good and I prepare. Now, what I sensed when I encountered Mimi was that this pre-trauma context had really been shattered by the experience of the plane crashing into her house. And Mimi was very disorganized in that way, in a shattered way. She came to me. And interestingly, if you reflect on it, it really allowed Mimi to make the changes she eventually did make, because her protective stance was loosened, basically. And you know, when our clients have the anxiety breaking through, when they come to us in distress, they're actually often more available to change. And sometimes, you know, we don't encounter our clients this way. We encounter them very locked down in their way of being. And so we've got to kind of work to soften that rigid protective stance. But in this case, Mimi was really open because she had really been shattered. So her protective stance seemed to be at this point, this anger that, and the sense of injustice. It isn't fair. I wasn't prepared. You know, Mimi was unaware of the implications of what she was saying. It was really mainly and only directed at the stupid man, the pilot. Her sense of self seemed to be, I'm good, but good doesn't keep me safe. And so there was a very confused sense for her of what does that mean? And the sense of others were, others will do unfair things to me. And a tremendous amount of fury towards those who hurt her and could potentially hurt her children. And her sense of the world was, for now, the world felt quite unsafe and unjust and shattered in a sense. So as I understood the nature of the problem, Mimi's symptoms of rage and reliving the event and the insomnia were indications of she continually was re-traumatizing herself as she re-experienced the event. And below that was Mimi had had a flawed pre-trauma personal context that made her believe that if she did good and she was a good person, she'd be safe in the world. And that assumption was really shattered by the violence of the event, causing the constant raging. And the functionality of her raging seemed to imply some sense of betrayal, even though she was really not aware of the depth of the meaning of what that betrayal was. So I wondered if it functioned to protect her from being aware of an existential given, which is that, you know, we're all vulnerable to bad things happening. We can't keep ourselves from those bad things happening if, you know, by being good and being prepared. It just doesn't work that way. So my context as an existential therapist helped me be present to that, to the potential of her blocked awareness of an existential given. And this is an important piece that I talk about often with my students about. There are 4 dimensions to be aware of as therapists. The first dimension is the internal experience of the client. The second dimension is the relational experience between you and your client. That's the relational dimension. Then there's the dimension of my experience as a therapist. And then the 4th dimension is the ontological dimension, the experience of the existential aspect. And I think that's what we bring as existential therapists, that additional dimension of awareness that can really help. For example, in this work with Mimi, to appreciate where might she be blocked in this dimension. Well, part 3 is to develop and collaborate with her on goals and methods. So I said to her, Mimi, you're experiencing PTSD from your event. It's causing anger, agitation, anxiety, and insomnia. And then I seeded a possibility, and it may also have triggered a deeper issue. So that was important to just seed that as a possibility for Mimi. We developed and collaborated on goals and methods. I said, we'll work experientially with your trauma to eliminate your symptoms and bring back the old Mimi. I added that because Mimi was saying, I just want to be my old self. And of course, I supported that. But at the same time, my sense was, if our work really progresses in a positive, effective way, she's going to be different. She's not going to be the old Mimi. But I'm not going to say, no, 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 you're not going to be the old Mimi. I'm going to create that. I'm just going to sort of support her, align with her in that. So our therapy was only 8 weeks because of Mimi's due date. Mimi's PTSD therapy wasn't a standardized trauma treatment because as existential therapists, we don't really engage in standardized treatments. We really tailor it to the individual. And I trusted that if I was present with curiosity to Mimi's meaning-making process, that Mimi herself would lead us through the layers of trauma that she needed to go through to heal. And during our time together, I really brought in our relationship. I made many relational check-ins. How are we doing? How has that been to share with me? What's not working? The value of staying connected in that relational way, I can't emphasize enough. It's crucially important to create a sense of intimacy and safety with our clients and collaboration. So Mimi was very much on board. So here's how the therapy progressed. The first layer was to help Mimi dissolve her anger and her sense of injustice. Mimi kept saying, it isn't fair, I wasn't prepared because of that stupid man, my home is ruined, mice are running rampant, gnawing at our things. As I said, she repeated the phrase, always with a tone of angry injustice. I alerted her to her anger and tried to reframe it so she could let it go. So I said, your anger is gnawing at you like the mice are gnawing at your things. Would it be helpful for you to let go of this anger? Again, here I am inviting Mimi to collaborate with me and to get a buy-in. Yes, she said yes. So the first part of the work was to create her safe space and then to teach her the stop technique. And I'm just going to very briefly describe what that is. This is really important when working with people who've experienced trauma, to have them develop their own safe space that they can go to and be in and work from when they're dealing with difficult traumatic experience. And so the safe place is, I invited Mimi to reflect on a time in her life, a place in her life where she felt really safe and cozy or terrific, wonderful. So for people, it can be outdoors at a beach or a beautiful lake. Sometimes it's in their bedroom, their grandma's room, wherever it is. And then I invite them to take time to look around and see your safe space. So visualize, what do you see? And then I ask them, what do you hear in your safe space? And then I invite them, what do you smell in your safe space? So I want to activate all of their senses so that they get anchored and grounded in their safe space. And then after that, then I taught her the stop technique, which is a very typical cognitive behavioral. Brack, have you got a question? No. a typical, very helpful cognitive behavioral technique, which is inviting your client to take a rubber band, put it around her wrist, and snap it every time she recognizes she's going into that repetitive pattern of, it isn't fair, I wasn't prepared. So Mimi snaps it, and then we told her that taking deep breaths really helps. So take 3 deep breaths, and then visualize your safe space, and then go into your safe space. So it's a way of stopping the repetitive pattern of re-traumatizing herself and having her instead have a positive experience of safety and relaxation. So I asked Mimi to practice that during the week, and by gosh, she did. She faithfully followed our strategy, and she reported feeling less angry, anxious, and sleeping better. So it struck me that it was now time to revisit the phrase. And I'm not exactly sure why I decided that this phrase was so significant in leading us to deeper levels, but I did. And it seemed like it was the very effective method. So we revisited the phrase, it isn't fair. And this time I asked Mimi to place her hand where the phrase seemed to reside in her body. And this is very important because now we're engaging the somatic aspects of the trauma with the client. And so Mimi put her hand on her stomach. And then I asked you to do the following. Now, Mimi, slowly repeat the phrase and see what thoughts and feelings and associations emerge. And breathe and take your time. And as she did, Mimi began to cry, and there was a release. And she said, it isn't fair. I wasn't prepared. There was no place to hide. I thought we were going to die. And the tears just started streaming down Mimi's face as she said it. And the release was palpable. And Mimi was opening up to her terror of dying and the vulnerability that she had not yet been able to feel because her anger had been blocking this awareness. So this was a very powerful moment that I didn't know what was going to happen when I asked her to connect somatically. And again, this is an aspect of our work that we really just want to get curious and trust the process. Layer 3 was an additional aspect of releasing the trauma from her body. And this is where I used a modified EMDR strategy to uncouple the feelings from her memory so her residual anxiety could be dissolved. So this is the strategy of the EMDR, to find the sensations of the memory in your body and put your hand there and describe them. And so Mimi put her hand on her stomach and she described the sense of vulnerability, the sense of fear, the tightness there. And then I asked her to imagine yourself safely on a train and the memory is outside, just going past you, like the passing landscape. Just imagine it's going past you and say to yourself, there's the memory I'm letting it go past me. And this is an effective strategy for allowing the residual trauma to kind of leave the body. As Mimi said, there's a memory, I'm letting it go. I'm letting it go past me, recognizing it's in the past and she can let it go. So I'm not sure what week this was in our work, but this was pretty much the final part of the work with Mimi. This was when she de-repressed, as I said, an existential given. So I invited Mimi once again to associate with the phrase, "It isn't fair, I wasn't prepared." So this time I asked her to put her hand where the feelings were, and this time she put it by her heart. And I asked her to close her eyes and go slow and associate with the feeling. It isn't fair, I wasn't prepared. And she spoke it in a very different way, a much deeper, more grounded, more vulnerable way of expressing the same statement differently in this at this moment. And then after a very long pause, and again, tears began to stream down her face, she said, "There was no plan. There is no plan, no structure, no protection. Anything can happen." So in that moment, and I didn't know that Mimi was going to go there, Mimi was opening up to the existential given of uncertainty, of contingency, of our vulnerability to bad things happening to us. And we don't have protection against that. And this de-repression allowed Mimi to understand that her personal context had been flawed. This belief about if I'm good and I prepare, I'll be safe. She began to realize that it was flawed, and in fact, it had betrayed her. This was an incredibly powerful moment, as you can imagine, in the work with her. And it was like, she just kept saying it over and over again, that I didn't know that anything can happen, that I'm vulnerable to this. And that ability for her to appreciate that seemed to me to be an extraordinarily significant recreation of her personal context to be healthier. And in fact, that is really how she described it. So this therapy was a really unexpected, interesting work, because I knew I could help Mimi heal her trauma. I knew I could do that. I did not know that Mimi would be able to go to this deeper level of awareness, where she was able to let go of her flawed personal context and create a more realistic one. And what she said was, I'm a good person, but also I'm a vulnerable person, and bad things can happen, but I'll handle them. And this was so important for Mimi to come to be able to appreciate, yes, she's vulnerable and bad things can happen, but she can handle them. So the paradox here is that only when Mimi accepted life's uncertainty could she find true inner strength. And by the end of 8 weeks, Mimi reported feeling great. She was sleeping well. She wasn't enjoying her life, her family again. She said she felt freer and less rigid, more spontaneous. And a year later, Mimi checked in saying, I'm like my old self, but better, which I loved because she wanted to bring the old Mimi back, but in fact, she created a better version of herself. So I want to stop and just check in about thoughts, feelings, reflections on this case.
Orah, several times as you were talking, you said that you didn't know what would happen next.
Yeah.
And I'm wondering if you would talk a little bit more about that, about being a therapist who doesn't know what will happen next.
Yeah. Sure. Well, you know, I trust the process. Implicitly, I trust process. And I trusted that this process of focusing on this phrase for Mimi was what would take us to her deeper levels of being. But I had no idea what that would mean, what that would look like, what the outcome would be. And I feel like for me as a therapist, if I trust process, good things, healing processes happen, and they do. And it allows me to not have too many assumptions and to not have too many intentions. The only intention is to stay present with her, to help move aside ways in which she might be blocked, and trust that if I do that, Mimi will go to the places she needs to go to heal and change. And I love to work that way because in that way working, I'm always surprised and it's always a wonder. And I'm always in awe, frankly, of the courage and the capacity for my clients to heal in the way they do. And sometimes, you know, most of the time it's not as straightforward. This was an extraordinarily easy, in a sense, piece of therapy to do because Mimi was incredibly focused on changing, and that went a long, long way in helping her do the work she needed to do. Stephanie, did that answer your question?
Partially. I think the other thing I was getting at was the times as a therapist that you might be afraid to ask a question that, you know, like they say, a lawyer in a courtroom shouldn't ask a question that they don't already know the answer to. And particularly with the somatic stuff, I think sometimes it's scary that you don't know what will come out next.
Okay, so it might be that you're really speaking more from your own context, that it's scary for you that you don't know what will come out next. Mm-hmm. What, can I ask what's scary for you?
That something might occur that I don't know how to respond.
Okay. And what then? If you don't know how to respond, what then? What's so bad about that?
So realistically, I know what I do. I sit quietly and see what happens.
Uh-huh.
but internally there's a sense of inadequacy.
Okay. And when that feeling of inadequacy gets triggered, what can happen then?
A sense of shame.
Mm-hmm. So just notice, Stephanie, as you've just sort of done that exploration, that knowing that that could get triggered might stop you from doing that work somatically, for example, because you're afraid you're not going to know what to do, and you might get triggered into that place of being inadequate. So that's a place for you to keep working with and trusting. Mm-hmm. Thank you.
Or can I just add to that? I love what you were saying, Stephanie, because that's been one of the most difficult parts for me in learning existential humanistic therapy, you know, later, like after my initial career, and is letting go of this idea that that there's certain ways people are that I should know, as opposed to the unique subjective experience of the client. So retraining myself in that curiosity, in fact, not knowing, has been a real, you know, learning point for me.
And Breck, when you say for you not knowing has been a learning, are you saying that it's been challenging to let yourself not know?
Yes, right.
Okay.
Because I had this idea I was supposed to be a professional psychologist who knew about trauma.
Right. Right.
Which is in one way true, but in the distinction of the uniqueness of each client and my patience in not knowing that has been a real learning point for me.
Yeah. I think you're both bringing up such important aspects that really separate the existential humanistic approach from other therapies. The lack of standardization is so unique. I don't know that it's totally only the therapy that is that way, but I know it's unique, and that, as you could tell throughout this, case, I'm using some very standard trauma methods to work with Mimi. However, what's different is that I'm trusting a process of Mimi going through the different layers of her trauma, and I'm staying connected not to what the methodology of how do you do trauma work is, but really what Mimi is saying that she needs, what's unique to Mimi. Think about this for a minute. Mimi could have walked in saying anything, right? She could have walked in saying, I can't believe this happened. I just couldn't really believe that this plane could crash into my house. Now that's a very different expression, isn't it, than how Mimi came in. Listen for a moment to what Mimi said, and you can begin to hear, what Mimi needs. Breck, listen. She said, "It isn't fair. I wasn't prepared. That stupid man, blah, blah, blah." So as you begin to dream into Mimi's needs, what are you hearing? What does she need? What's she saying? What's she expressing? Can you hear the failed belief that if I'm prepared, I'm going to be safe? Right?
Well,
It's right
I think,
there.
well, yeah, I can hear it now, but I think for me, when you first said that sentence, I was like, oh my gosh, what does that mean? Right? Right? Like before, I was like, oh, the classic trauma approach is, people feel like it's unfair. This is something that happens, but it's in the details of what that person, it's the specifics for Mimi that's like,
That's
I don't know
right.
what that means for her. Right?
That's
I think,
right.
and
That's
digging
right.
into that has
Digging.
been,
That's right. That's it. And starting with that phrase and letting it go deeper within her led us to the deepest levels of her structure of being, which meant for Mimi a belief, a core belief that if I'm prepared and I'm a good person and I do good, I'm going to be safe. I didn't know that at the beginning, but I felt something about that.
Orah, can I add how
Sure.
much I love this part, this piece of invoking the actual, right?
Mhm.
And trying to just be very attuned to little, sometimes tiny details that you don't, sometimes it's just being there, right? And trying to see what's there. And
Yeah.
and I particularly love this part, and I think it's so important. And yeah, I just get amazed every single time, right? Like I get in awe with every single client. Like if you get really attuned to me, it's like if I get a needle, right, and I'm trying to pursue, and that's the part that I definitely think it makes a huge difference. And yeah, it makes us more present too, right?
Yeah, to the particulars, those details, the particulars, and to trust that will lead you somewhere. To trust, that's the trusting the process. So I'm aware it's 11:19, and how are we doing in terms of the time for, do we have some time for a demonstration? Yeah?
You have 40 minutes left.
Okay. Are there any questions from the audience? Any comments?
Hi, Orah. As I was listening to you talk about Mimi, I was kind of reflecting on some of my own process as a therapist, and I posted this in chat. But one of the things I do prior to seeing a client is like I try to contact the great therapy gods and try to I tell them to please help me help my client. So this statement, trust the process, which seems so very important to our work. It's about cultivating something in ourselves as therapists. And I don't always know what it is that I'm cultivating. It's like I'm cultivating some kind of new listening that I've never had before. And I'm trying to give over or surrender to this betweenness between myself and the client. And I guess I was hoping that maybe you could talk about or help us talk about what really is happening in that moment. What are we giving into? What's if we're giving into something, what is it that's coordinating our session? And I know I've had those moments in therapy where it's like I go through some motion that I don't even understand, and it breaks something over for a client, and I'm sitting there like, oh wow, great therapy gods exist. But I guess I want to understand it a little bit better.
Yeah, me too. I've always wanted to understand it a little bit better. Actually, you know, Brent, that's sort of been my whole focus of my work, actually, to really understand it, to put words to it. And it isn't easy. It really isn't easy. So it's, first of all, I think there's a need for us as therapists to cultivate as deep awareness with ourselves and our process and our wounds and our protections as much as we can. That's number one. To be able to be aware of them and to have our wise self, so to speak, be as present in the moment in our work with people. So these other parts don't get too triggered, don't get too enacted. I think that's important to start with. So think about all of these parts in ourselves, my wounded part, my protective way of being, to have them feel comfortable and safe and relinquish to my wise self, my grown-up self, my mature self, and let that part of me be present. And then to really, the concept of cultivating presence. So that's, I'm starting with myself, and now I'm opening to the other. And I'm staying with myself, but I'm also focusing on their world, on who they are, what their wounded parts are. I don't know what they are. I know everybody's got wounded parts. Everyone's got protective stances. I know that, but I don't know what they are, but I'm opening to them. And I'm listening deeply to how they say what they tell me and their way of being. Are they trying to please me? Are they sitting back and avoiding? Are they being very intellectual? Are they reporting a lot? Are they very self-critical? Are they unsure of themselves? I'm noticing all that. But it's not just I'm noticing, I'm feeling it. My wise self is feeling it. And then, you know, and then they might do something or say something that activates, triggers me. And I might recognize I'm getting scared. Like Stephanie recognized, you know, she's getting scared. I don't know what to do. This is really important information. And so I notice it. And hopefully it doesn't take over. Sometimes it does. Hopefully it doesn't. And so then I can notice it, and I might hold a mirror up to my client at that point. Do you notice you're doing a lot of reporting right now? Telling me about yourself rather than coming from that inside place. Do you suppose you could make that shift and find what's going on inside of you? And then, so let's say I get triggered, and now I want to sort of do the work I need to do to kind of settle, to get regrounded. So I might take deep breaths. For me, that works a lot. That helps a lot. And then I get settled. And then my wise self is able to be present again. Is that helping to help you understand how I do this? That sort of process?
Yeah, I mean, it's just nice to be able to talk about it as a process for us, because
Yeah.
I think too often our training, at least for the most part, seems to suggest that there's like very carefully constructed skill-based steps in order to reach X, Y, and Z for the client. And this is really about getting in touch with the self. And we don't talk about that a lot, especially I'm in a very cognitive behavioral world, and we don't talk a lot about that, getting in touch with yourself in order to be better for the client.
Yeah.
I think it was just good to hear the reminder that this is what we are working on.
That's so great, because, you know, Brack and Stephanie and Almu are in my consult groups, and they know that our focus is not on these steps to take to heal. Am I right, guys? Yeah.
Yeah.
Yeah. And I think, unfortunately, and you're right, Brent, that part is so lacking in training. And that's why I created these experiential trainings that focus so much on us as therapists, recognizing we are the tools, and we've got to know ourselves, and we've got to know what matters, the value, the significance of being present with another human being, how to be that way, and how that in and of itself is healing. Thanks, Brent, for bringing that up.
Thank you. I appreciate it.
Is there anybody else in the group who's got a question? Maybe I can. I'm going to stop sharing so I can see everybody.
Orah, I have a question.
Yeah.
It's really about the struggle and the challenge to hold directive versus non-directive components in therapy practice, especially in a like modern day goals and objectives for performance, for reimbursement kind of setting. I find myself sometimes feeling not great about offering like CBT interventions, even though at like the heart of my work, I'm trying to hold space for really just being present with people who are struggling. And I find that sometimes I feel I have to satisfy like certain check boxes in treatment in order to, part of that's working at a medical center, and that's a choice I've made in my career. But, you know, trying to balance like creating a setting and an environment for these things to come through, you know, the client's pacing and direction versus those gentle offerings of trying to see if they're ready to try something different or open up in the kind of in the way you're saying, where without judgment, right? Without them feeling bad that they're not already there or they're not already doing those things.
So Chris, are you asking what's a good way to navigate what you have to do externally with your clinic versus how to really be as a therapist with the clients in the way that you want to be? Is that where the tension is for you?
Definitely for me. And I realize there's like 5 questions in one there. So
that's okay.
Maybe I'll highlight the priority, which is, you know, for me personally, it's wrestling with like professional choices of where to work in this way. Okay. Like a private practice setting versus, you know, I carry a panel of about 85 patients to 100 patients.
Wow.
And so I can only see people every 3 to 4 weeks.
Yeah.
And then, you know, I'm bound by pressures to sort of prove to my medical colleagues that who sometimes ask in the referral, please CBT my patient out of their depression. And then I wrestle with whether or not to inform them that I'm not actually a CBT therapist, even though I use CBT and DBT intervention from time to time. But I think just a better priority question is that choice point of, do I try to be more directive in this moment, or do I actually like set back a little bit and see if they can invite themselves into that journey?
Okay. Okay. Now I understand what you're asking better. My sense is, do whatever you need to do to make everybody on the outside happy. And then you decide what your Pusto is. This is a wonderful concept from Jim Bugental. This is our place to stand as therapists, who we are, what we value, what we trust, what we know, what our approach is. And my Pusto, as a therapist for 30 years, has always been cultivating presence to myself and to my client. That to me is the foundation, the ground on which I stand and I believe and I trust in. If I cultivate presence, and that means a full-bodied, somatic, sensitive, empathic way of being as my ground, I can work in a whole lot of other ways, as I did with Mimi, cognitively, somatically, trauma work, and so on. But the ground is always to be present. The ground is to be present. And what does that mean? As I talked with Brent, I stay connected to myself. I recognize when I'm activated, when I get defensive, how my client is defending. And when you say be directive or sit back, it's really, I know what being directive is. So, and I don't find much value in that. But sitting back is really a misnomer, because I think, as you could tell when I was describing the case with Mimi, I wasn't sitting back. I was very engaged in working with the process, working with her meaning-making process. Very engaged and following it and noticing where she's getting stuck or where she's blocked, where she's protecting, and trying to help work through that. So I always have this, I recognize I have this reaction when I hear people say, you know, I'm just being present with my client. Because it's not about just being present. Being present is an incredibly active process of following your client's process. Right, Terry? And Amy? These are two other people in my other consult groups. Yeah. Does that help, Chris?
Yes, quite a bit. And I think it is semantics about, you know, sitting back from the directivity of the session. And then I actually really appreciated your overview of trusting the process, and really, you know, these things seem like simple and understood, and they're not. I think we come back to them again and again for their depth, not because I often hear some of my colleagues are very behavioral driven, and I often hear them say they are good listeners. And I wonder about that, actually, in terms of whether they, like how they see that. And usually it means they are hearing the answers to the questions they're always asking. But I don't see that as the same thing as engagement. And that's kind of what I hear you saying, is that it may look passive to a behaviorist, where it's actually quite active and engaging in terms of the felt sense and the connection of relationship. Yes,
exactly. Yeah, you said it exactly. Yes. Yes. Mm-hmm. Is that Brian over there? Hi, Brian. Nice to see you.
Yeah, good to see you too.
Yeah. Brian's in Chicago, right?
Yeah.
Yeah, good.
Hmm.
So what else? Should we do a little demonstration? Would you like that? Yeah? Okay, great. Who would like to work with me? It could be anything, that's something that came up. Almu? Yeah? Did you want to?
I will be happy, but yeah, I was waiting for in case anyone else wanted. I'm happy to do it as a backup.
Don't be afraid. Don't bite. Terry, would you like to? Terry,
Yes.
Okay,
Hi.
great. Wonderful.
I'm very moved by the conversations we were just having. I feel like really emotional. So whatever work we're doing right now might look a little messy.
Just allow it to be and be yourself. Yeah. Is there some way that I could have a little bit more of a connection with Terry other than, probably not, huh? Okay.
What are you looking for? You mean like just to have the both of you on the screen at the same time?
Yeah, would that be possible?
Yeah,
How do we do that?
let me do that right now.
Oops.
Do you see her up on your screen now?
I see her, but she's still a little square.
There I am.
Is it just the
Okay.
two of you now?
No, everybody's there, but that's okay. She's a little closer to me, so that's good.
There might be a view that you can change to speaker view, and it should pin both of you in the top right corner.
Oh, speaker view. Okay.
Yeah, see if that one gives just
Oh,
the two of you, and then you've got
there we
people
go.
at the top. Wonderful.
Okay, great, wonderful. Okay, Terry, how about we just do a little bit of work? We'll just maybe 10 minutes, just see where we are, where we go.
Okay. Mhm.